Whether you're an NFL quarterback or just a regular gym junkie, you're at high risk of a shoulder injury. The shoulder joint has the greatest range of motion of all the joints in the body, making it especially prone to injury. A new study from the Journal of the American Academy of Orthopedic Surgeons has found that instead of doing this, you need immediate medical attention for a dislocated shoulder in order to reduce future complications. The study's author, Dr. Thomas Youm, a board-certified orthopedic surgeon, joins me to discuss. Did you authorize that video?
No.
Why do shoulder injuries happen so much?
Well, the shoulder has one of the most, the largest ranges of motion of any joint in the body. So we put our shoulders in awkward positions all the time. A lot of people who develop shoulder injuries, they play sports, they tend to be younger, and those are the ones that tend to dislocate.
And how do you know when you've dislocated?
You know, it's not a subtle thing. So shoulder dislocations, when they come out, it's very painful. You all of a sudden can't move your arm. You restrict your range of motion, and it's a situation where you just can't use your arm.
You can't use your arm. So it's not like one of those things where I may have dislocated my shoulder.
So there is something called a subluxation, and what that means is that the shoulder pops out, but it pops right back in.
Because my shoulder pops out a lot.
Yeah, so you have...
So let me ask you a question since I get some free medical advice here.
Okay.
So I haven't dislocated in a long time, but I still have these pains. Like when I do this with my arm, you hear those noises?
Yeah.
That happens all the time. Sometimes it hurts a lot and I do this. You can't hear the popping up, but when I do that, it stops the pain. And then other times it's an extreme pain until I move it a certain way. What does that mean?
So we get a lot of patients who complain about cracking, right?
Yeah.
Cracking in itself without any pain really doesn't mean much.
Okay.
But if you have cracking and it is painful or it's related to pain,
Yeah.
it could signify an injury.
Okay. Someone told me it could be tendonitis as well.
It could be tendonitis. It could be bursitis is what we call it. Inflammation sometimes cracks. But it can also, if you've been active in your life, it could suggest that there could be a tear inside.
Huh. And these tears, and I don't mean me in particular, but these sorts of tears, do they always require surgery? Or does the everyday non-professional athlete, can they just sort of just exist and it heals itself eventually?
You can exist. It may not heal itself, but with proper rehabilitation and avoiding certain positions, you can live with a shoulder that might have a tear.
So I shouldn't play slow, fast-pitch softball?
That might not be good.
Okay, seems reasonable. Seems reasonable. I thought about Kobe Bryant.
Yes.
I'm sure you've seen this. He needs rotator cuff surgery.
That's right.
Some people have argued that's because he played too many minutes. Is this the kind of injury that has a cumulative deteriorative impact? In other words, is it possible that just playing too much could do this?
There is a component to that. Rotator cuff injuries tend to happen in patients over 50, right? But with the amount of miles and minutes that Kobe has put on his shoulder, it's a wear and tear phenomenon for sure.
Gotcha. It's not trauma. It's not traumatic.
If it was traumatic, he probably wouldn't be able to lift his arm right away, right?
Gotcha.
It would have been a situation where he fell, immediately couldn't lift his arm.
Gotcha. Yeah. But this is just wear and tear. And I think he had some sort of minor tear at the beginning of the season that continued.
I believe so. I believe he had a shoulder that was abnormal to begin with, that he was playing with, and that over time wore and tore to the point that he developed a rotator cuff tear.
So it's pretty much just being old.
No, he's not old.
Well, in basketball years.
In basketball years, perhaps, but that would do us injustice.
Yeah. Hey, he and I are like 3 months apart, so believe me, he's not old in real life. Just in basketball, playing.
A lot of minutes.
A lot of minutes, and that's something. Is there anything you can do to prevent shoulder injuries, particularly as you get older? Are there things you can do to reduce the likelihood of tearing things?
I think there are certain sports that put more wear and tear on your shoulder, basketball being one of them. If you're any sort of overhead thrower, right, whether it's baseball or football, that puts a lot of wear and tear on the shoulder. Yeah. Even tennis. So I think picking sports wisely, right, not trying to play through pain, those are things you can do to control your shoulder.
But I'm hearing you say also that people over 50 commonly tear rotator. Are these people who were active athletes, or just everyday motion after a while can do this?
Everyday motion. We believe the blood supply also to the rotator cuff tendon tends to decrease over time. Yeah. So that also has something to do with it.
Is there anything that people who don't play super active sports can do to reduce the likelihood of rotator? Like if you're 50 years old, is there something are there stretches you can do? Are there exercises you can do? Are there things you can do to reduce the likelihood of having these major shoulder injuries?
Absolutely.
Not just rotator cuff, but other major shoulder injuries.
Absolutely. I think a good strength training regimen and a flexibility regimen where you're working your rotator cuff muscles, dumbbells, keeping the deltoid muscle around your shoulder very strong.
Yeah.
That'll help reduce injuries in the future.
But you also don't want to go too heavy, I'm sure.
That's right. That's right.
And how do you strike that balance? Is this where trainers come in? Is there a general rule of thumb per body weight?
So I think in general, sometimes trainers can overdo it because people who get trainers, they want to see results, right? So they want to see strength, muscle mass. So that can actually lead to injury.
Okay.
So keeping yourself in a painless range of motion when you do your strengthening exercise, lots of reps, lots of sets, not always trying to maximize the failure of the muscle. I think those are good tips.
Okay, because I do the opposite. I work out till failure.
Most of us do.
Yeah. Is that what you do?
Well, at this point in my life, not so much. I try to maintain whatever I can.
I always wonder, like doctors who know better, do they still go in the gym and try and bench press 1,000,000 pounds just because they can?
No, not anymore.
Smart man. Smart man. You're gonna be around a long time with two good shoulders, sir. What's that right there on the table?
So this is a model of a shoulder, and what we have here, this is the collarbone, this is the socket, and this is the ball. So this right here between the ball and socket is what we call the shoulder joint.
The shoulder joint.
Yeah.
To use the technical medical term.
Well,
for it.
I can get technical. We'll keep it as a shoulder
Fair
joint.
enough.
Yeah.
That's complicated enough for me. So this is interesting. So and this is about as far up. Oh, I see where the tension comes, right? So right about here is as far up as you're supposed to go.
Well, this model doesn't have the ligaments and muscles on there, so the shoulder can go way higher. 180 degrees, forward elevation. It can go all the way back. It can rotate.
Gotcha.
But this is just a model.
But is there? I guess what I'm asking is there a motion beyond? Is there a point beyond which it becomes less safe? Like I even feel resistance right here.
Yes.
This is about as far back as when you feel the pain. Is that when you should stop doing it?
Yeah. So this motion right here, where you bring your arm all the way back, it's called abduction and external rotation.
Yeah.
If you feel some pain there, this is the motion of dislocating your shoulder. So if you have your arm like this, and somebody awkwardly pushes that back, it can actually pop out the front.
That sounds like it would hurt a lot.
Yes.
I don't want to do that.
No.
I won't do that.
No.
Ladies and gentlemen, don't do this.